Hi, my name's Kirsten Eagles. My student number is T00698082. And I'm going to be going over some things that I've kind of learned on how to create kind of better connections with our clients. So after thinking about it, there's really one person that kind of stands out in my mind when it comes to connecting with our clients, and that's my Aunt Shannon. So Shannon was a vet at the clinic that I'm working at now. She actually helped me get the job. And recently she passed away. So she passed away about 2 years ago. So when that happened, the outpouring of love that we received from her clients was exceptional. She had a way of making a connection with every single person that came in to the clinic. Um, she really kind of had a special way of going about things to really create those connections that lasted a long time. So she specialized in acupuncture. And there was a lot of times where I would help her with those appointments. So the first thing that she would do when going into the room is kind of immediately greet the patient and the client almost as if they were family. So kind of asking, what they've been up to, how they've been, how are the kids, that sort of thing. So it was, I feel like starting appointments that way is really a way to kind of get to know our clients better. So rather than kind of jumping right into the problem head on, is spending that time discussing with them, how things are. So another thing that she would do is that she would get down on the floor with every one of her patients. So rather than getting them right up on the exam table and examining them there, she would be down on the floor with them, interacting with them, and it made it feel kind of less of like a clinical experience and more of just kind of like a hanging out sort of thing. And I think a lot of her clients actually really appreciated that. It made her feel like she was a friend rather than just a doctor coming in to check it out and go from there. Another thing that she would do would be her follow-up care. So a lot of doctors, oftentimes, they'll just get like the reception to call and check in to follow up with a patient, whether it be like after surgery or after testing or something like that. But she would call every client personally to be able to talk about those issues and kind of get a real understanding of how things are going with their pet, which I really admired about her. Taking that time to sit and talk with them rather than just handing it off to someone else to deal with. So by building those relationships with our clients, when it comes time to have those difficult conversations, I feel like it can kind of make things a little bit easier to have that discussion, and people are a little bit more understanding. They don't just see us as the doctor who ran the tests and now this is the answer. It adds kind of some humanization to the conversation, and helps them to kind of realize that we are human and that we do really care for their pets and that this is hard for us too and that we're there for them. We understand how difficult it can be. So I think that's something that clients can really appreciate, is that kind of level of understanding that we gain from having that relationship with them. So since Shannon has passed, we haven't had anybody who has done acupuncture, but recently our head vet, she has taken over that role, so she's done the acupuncture course. So she's starting to do more and more acupuncture appointments, and I've been asking her if I can help assist with those, because it allows me to be in the room with the clients for kind of an extended period of time where we're not just doing testing or examinations. We're just sitting there while the animal relaxes and gets their acupuncture done. So it allows us to have those conversations. Like the other day, we had the SPCA come in with one of their long-term dogs. And so I sat with them for a while and we talked, and I got to hear some stories about the dog's history. And we really connected on a different level than I ever have before, rather than just, giving them a quick phone call to tell them a pet is ready. So I'm hoping that in the future I can continue to help her with those and help kind of build those relationships with our clients, because it's something that I definitely need to improve upon, but I'm really looking forward to be able to do that. So to kind of recap the steps that we can take to help build those more meaningful connections. So number one, talking with our clients, really getting to know them on a deeper level. Number two would be to interact with the patients in a way that's less clinical, making them seem like it's our kind of pet too, that we want to be their friend and that we want to be our client's friend. Number three would be kind of more personalized follow-up care. So rather than just quick calls, check in, doing all right, taking the time to sit and discuss with them, kind of go, you can get a lot more information if you just take the time to talk. And with those things, all of those things, again, can help make those hard conversations a little bit easier to have with our clients, and they're a little bit more understanding. So all in all, that is my take on how to build more meaningful connections.